So my name's Colleen Donnelly. Before coming to this class, I hadn't had much implant experience. I had just done some restorative, but hadn't placed any implants. So I hadn't taken an in-depth implant course before, but I had looked and evaluated many of them. What kind of set this one apart was that I knew that it was a smaller group and that the doctors who were teaching it had a lot of different experience. After taking this course, to be honest, it's blown me away with how much more knowledge you obtain during this course. And I've taken many other types of courses and they pretty much stick to what the curriculum is. But here, not only do you get so much experience placing implants, but you gain so much more knowledge in just the comprehensive treatment planning and procedures on patients. So during this course, I've placed about over 30 implants. And it ranged all from immediate implants in certain extraction sites to fresh sites that were healed. It also included complete denture patients that had their extractions prior and were changing to an overdenture. The last case I did included everything from full arch extractions to implant placement, bone grafting. We delivered her denture, and we even prep teeth and temporized them. So this course really gives you an education in every part of restorative treatment planning along with the implant placement. So during this course, there were a lot of topics that were covered. Personally, I prefer the more restorative part of dentistry, but as I've had, since I've been about 10 years since I've graduated, and with the experience that I've had, you really get to learn that restorative and surgical comes hand in hand. So to really have full control over even your restorative treatment, you really need to have, ideally that surgical experience. And that's why this course is perfect, because Dr. Chapman and Dr. Brown have extensive knowledge in not only implant placement, but comprehensive restorative treatment, and really bring all of that together. After doing this course, I definitely feel that I have the tools to go and place implants. What this course does is it's very similar to doing a residency, even though it's very compact and only a few days. But you really get to see an array of cases. So you're doing much more complicated cases, but that along with the simple ones, and that prepares you when you go back that you've seen more complicated. So when I start and I go back to my practice and I see a more simple case, I am fully confident that I can do that because I've done even more complicated cases. And then I know if and when I come back to do the next level course, and then I will get even more comfortable doing those more complicated cases. So I've done a lot of different CE courses, but this course by far, the atmosphere was the most motivating that I've ever experienced. All the instructors are super encouraging, helpful, they're very knowledgeable, and everyone is extremely supportive in your journey. And I know that that support is not going to stop once we leave this course. And not only that, the other attendees during this course that I've met, everyone has been very supportive of each other. It's been great to network with them, and I know that I will continue to keep in touch with them even after this course. I would definitely recommend this course to all of my colleagues. I know at this point not too many of my fellow classmates and friends and colleagues are necessarily placing implants, and they maybe didn't think that they could even get to that point. But after me doing this course, I'm definitely going to go back to them and encourage them to join this course as well, to get that confidence for themselves.